Knee extension against gravity position. You'll have your patient in a seated position with their knee approximately 90 degrees hanging off the table. First thing we'll do is, Owen, extend your knee out as far as you can. Bring it back down. Because he was able to do this, we know that he is at least a 3. Now, Owen, I want you to extend it out again, except only go about halfway. I will apply resistance to the proximal to the ankle and stabilize the thigh. I will apply resistance. Owen, resist me. 3, 2, 1. And there we go. Knee extension, gravity eliminated position. I will first pick up the opposite leg to allow full range of motion of the leg that we're assessing. Owen, extend your knee as far as possible. Now, because he was able to perform that motion with gravity eliminated, we know that that is at least a 2. If he could not do that, then I would be palpating the quadriceps.